Physiotherapists play a very important role in intensive care unit, and we provide a range of therapies, ranging from looking after patients who are mechanically ventilated, so looking after the chest care. Often these patients who are mechanically ventilated are at risk of developing chest complications such as pneumonias. So we make sure their lungs are clear, their airways are clear. So we use various techniques, manual techniques, positioning, and some advanced techniques to make sure their lungs are clear, they don't develop any complications, and that helps to speed up their recovery.
I'd come back from overseas and I felt okay for a week. Then I just sort of got flu-y and I sort of got tested and then realised that there was a problem. The hospital was good in having a nurse ringing you once or twice a day. And then I just felt really crook, so they sent the ambulance and things just went in a blur after that. I was barely there for a day and a half and I was in the ICU, and a day after that I was on the ventilator and knew nothing for 2 weeks.
And Jeff is a very good example. When he came to our intensive care unit after his overseas trip, he was a very sick man and he was severely ill, and within 3 to 4 days he needed to be mechanically ventilated. So from that day, physiotherapists were involved in his care, making sure he is positioned properly in the bed to maximise his oxygenation, because his oxygen levels were very, very low.
But to realise that was that serious, and I probably, if I had have known what I did afterwards, in terms of I've read some things afterwards, what actually happened, it's like, well, gee, it would have been pretty scary. It was still scary when I came out of it and you couldn't talk and all that sort of thing for a week. Yeah.
So after 6 weeks, he made a really good recovery. He's a really good example of a patient where physiotherapists were involved from day one till he went home. And even as we speak today, he is home. He is doing really well, but he's receiving physiotherapy through HIT Physiotherapy Service, which is Hospital in the Home Physiotherapy Service, and he's receiving physiotherapy twice a week just to get that last 10% of his strength and endurance back.
I thought about this actually. I said, it'd be good to talk to them and say, look, it's a marvellous vocation really, and you don't realise how the little things make the difference. They've got the skills obviously, but it's the care and the sense of you're a person and they recognise you're a person and you're different to the person next door, So I think I just can't speak more highly of the job they do.